Hello, and welcome to the CSRA eMedNI computer-based training for New York State Medicaid providers. This is the first video in our New Provider, New Biller series of tutorials. The purpose of this session is to familiarize providers with the roles and responsibilities of the Medicaid partners. The Medicaid partners include the New York State Department of Health, CSRA eMedNI, County Department of Social Services, Office of the Medicaid Inspector General, New York State of Health, Managed Care Plans, and you, the providers. The New York State Department of Health is responsible for Medicaid policy, procedure codes, required claim documentation, setting fees and rates, prior approvals, monitoring of fraud and abuse, over 2-year claim procedures, and provider enrollment. The website for the New York State Department of Health is www.health.ny.gov. In-state providers can reach the New York State Department of Health at 800-342-3005, and out-of-state providers can call the State Department of Health at 518-474-3575. CSRA eMedNI, as fiscal agent for New York State's Medicaid program, is responsible for processing your Medicaid claims, maintaining provider manuals on the eMedNI website, remittance statements and checks, electronic funds transfer, billing inquiries and guidelines, Medicaid provider training, issuing paper claim forms not including the UB04, electronic transmitter ID numbers or ETINs, ePaces, the electronic provider assisted claim entry system, and provider enrollment maintenance for fee-for-service providers. CSRA eMedNI also is responsible for MEVS, the Medicaid eligibility verification, as well as the Verifone POS terminal for checking eligibility, the Drug Utilization Review Program, or DUR, and the Dispensing Validation System, DVS. Contact information for CSRA eMedNI, the website is www.emedny.org, and eMedNI Provider Services can be reached at 800-343-9000, and the MEVS, the Medicaid Eligibility Verification System automated telephone number to check client eligibility 24 hours a day, 7 days a week by telephone is 800-997-1111. The local county Department of Social Services, or in the New York City area, the Human Resource Administration, is responsible for recipient enrollment and eligibility, excess recipient income, sometimes referred to as patient participation or spend down, issuing temporary client ID cards, some prior approvals or pre-authorizations, and overseeing the Medicaid Managed Care Plan concerns. You'll see here on the screen a reference to the eMedNI website, where we have a list in the provider manual section for information for all providers. Under the inquiry section is a listing of all of the local county Department of Social Services throughout New York State. The Office of the Medicaid Inspector General, or OMIG, is responsible for surveillance and monitoring of fraud and abuse, and their website is www.omig.ny.gov, and they can be reached at 877-87-FRAUD. The New York State of Health, or the New York State Health Benefit Exchange, is the health plan marketplace created by the Affordable Care Act. Medicaid recipient enrollment and eligibility for select populations would be handled by the New York State of Health. And when you check eligibility, if you get a county or office code of H78, that identifies the client having been enrolled through the New York State of Health. And as you see, their website is nystateofhealth.ny.gov. The Managed Care Plan is responsible for contracting with providers providing covered services within their scope of benefits of their plans, any plan procedures, referral process, recipient education, or maintenance of records specific to the managed care plan rules and regulations. And we have all of the managed care plan provider information, plan codes, telephone numbers located on the eMedNY website in the Provider Manual section under the Information for All Providers section. And you, the providers, you are responsible for verifying eligibility via MEVS, either through ePaces, the swipe card terminal, if you have your own software, or using the telephone, timely submission of your claims, seeking service authorizations or approvals when required, retaining appropriate medical record data, being compliant with HIPAA guidelines, obtaining and registering your NPI, following all New York State Medicaid rules and regulations, reviewing the monthly New York State Department of Health Medicaid update, and referring frequently to the eMedNY website for updated information. This concludes our Medicaid Partners tutorial. Thank you for joining, and visit us at www.emedny.org for additional training resources.